Welcome to the world of Apremilast, a revolutionary treatment that is transforming the lives of individuals suffering from chronic inflammation and psoriasis. In this video, we will delve into the power of Apremilast and explore how it is providing relief for those plagued by these conditions. Understanding chronic inflammation and psoriasis. Chronic inflammation and psoriasis are conditions that can have a significant impact on a person's quality of life. Chronic inflammation occurs when the body's immune system is constantly activated, leading to persistent inflammation throughout the body. This can result in a wide range of symptoms, including joint pain, fatigue, and gastrointestinal issues. Psoriasis, on the other hand, is a chronic skin condition characterized by the rapid buildup of skin cells, leading to the formation of thick, red, and scaly patches. It is an autoimmune disease, meaning that the body's immune system mistakenly attacks healthy cells, causing the skin to become inflamed and irritated. The limitations of current treatment options. Traditional treatments for chronic inflammation and psoriasis have often fallen short, leaving patients frustrated and seeking alternative solutions. Topical creams and ointments can provide temporary relief, but they do not address the underlying causes of the conditions. Systemic medications, such as corticosteroids and immunosuppressants, can be effective in managing symptoms, but they come with a host of potential side effects and long-term risks. Moreover, these treatments often only provide temporary relief and may require ongoing use to maintain results. This can be burdensome for patients, both financially and in terms of daily management. As a result, there has been a growing need for a treatment option that targets the root causes of chronic inflammation and psoriasis, providing long-lasting relief and improving overall well-being. Introducing Apremilast, how it works and its benefits. Enter Apremilast, a breakthrough treatment that targets the underlying mechanisms of chronic inflammation and psoriasis, providing long-lasting relief and improving quality of life. Unlike other treatments, Apremilast works from the inside out, targeting specific cellular pathways involved in inflammation and immune responses. Apremilast is a phosphodiesterase 4 (PDE4) inhibitor, which means it inhibits the production of certain inflammatory mediators, reducing the signs and symptoms of chronic inflammation and psoriasis. By targeting specific enzymes within cells, Apremilast modulates the immune response, helping to restore balance and reduce inflammation throughout the body. One of the key benefits of Apremilast is its oral administration. Unlike many other treatments that require injections or topical applications, Apremilast comes in the form of a pill, making it convenient and easy to incorporate into daily life. This can be especially beneficial for individuals who may have difficulty with other forms of treatment or who are looking for a more convenient option. Clinical studies and research on the efficacy of Apremilast. The efficacy of Apremilast has been extensively studied in clinical trials, with promising results. In a randomized, double-blind, placebo-controlled study involving over 1,200 patients with moderate to severe plaque psoriasis, Apremilast was shown to significantly improve symptoms compared to placebo. Patients treated with Apremilast experienced a reduction in the severity of their psoriasis, as well as improvements in quality of life measures. Similar positive results have been observed in studies involving patients with psoriatic arthritis, a form of arthritis that often occurs in individuals with psoriasis. Apremilast has been shown to reduce joint pain, swelling, and stiffness, leading to improved physical function and overall well-being. These studies provide strong evidence for the efficacy of Apremilast in treating chronic inflammation and psoriasis. The results demonstrate that Apremilast not only reduces symptoms but also improves quality of life, allowing individuals to regain control of their health and well-being. The potential side effects and precautions of Apremilast. As with any medication, Apremilast does come with potential side effects and precautions. The most common side effects reported in clinical trials include diarrhea, nausea, and headache. These side effects are generally mild to moderate and tend to diminish over time. In rare cases, more serious side effects may occur. It is important to consult with a healthcare professional before starting Apremilast to ensure it is the right treatment option for you. Your healthcare provider will be able to assess your individual situation and discuss any potential risks or concerns. Additionally, it is important to note that Apremilast is not suitable for everyone. It is not recommended for individuals with a history of depression or suicidal thoughts, as it may increase the risk of these conditions. It is also not recommended for use during pregnancy or while breastfeeding, as the effects on the unborn child or infant are not yet fully understood. How to incorporate Apremilast into your treatment plan. If you and your healthcare provider decide that Apremilast is the right treatment option for you, it is important to follow the prescribed dosage and instructions carefully. Apremilast is typically taken orally, with or without food, as directed by your healthcare professional. It is important to be patient and consistent with your treatment. It may take several weeks or even months to see the full benefits of Apremilast. It is also important to continue using Apremilast as prescribed, even if you start to feel better. Stopping treatment abruptly can lead to a worsening of symptoms or a flare-up of the condition. In addition to taking Apremilast, it is important to maintain a healthy lifestyle and follow any additional recommendations from your healthcare provider. This may include managing stress, eating a balanced diet, getting regular exercise, and avoiding triggers that may worsen symptoms. Success stories and testimonials from patients using Apremilast. Many individuals who have incorporated Apremilast into their treatment plan have reported significant improvements in their symptoms and quality of life. They have experienced a reduction in inflammation, itchiness, and discomfort, allowing them to engage in activities they once found challenging or impossible. One patient, Sarah, had been struggling with psoriasis for years. She had tried various treatments without much success until she discovered Apremilast. After a few months of treatment, Sarah noticed a significant improvement in her skin. The red, scaly patches began to fade, and the itchiness and discomfort subsided. She regained her confidence and was finally able to wear short sleeves without feeling self-conscious. Another patient, John, had been living with psoriatic arthritis, which made it difficult for him to perform everyday tasks and enjoy his favorite activities. Since starting Apremilast, John has experienced a reduction in joint pain and stiffness, allowing him to move more freely and engage in physical activities he once thought were out of reach. These success stories and testimonials highlight the transformative power of Apremilast in the lives of individuals suffering from chronic inflammation and psoriasis. It is important to remember that everyone's experience with Apremilast may be different, and individual results may vary. Apremilast versus other treatment options. A comparison. When considering treatment options for chronic inflammation and psoriasis, it is important to weigh the benefits and potential risks of each option. Apremilast offers several advantages over traditional treatments, including its unique mechanism of action and oral administration. Unlike topical treatments, which only provide temporary relief and may require frequent application, Apremilast targets the underlying causes of chronic inflammation and psoriasis. It works from the inside out, helping to restore balance to the immune system and reduce inflammation throughout the body. Compared to systemic medications, such as corticosteroids and immunosuppressants, Apremilast has a different mechanism of action and a lower risk of certain side effects. While all medications come with potential risks, Apremilast has been shown to have a favorable safety profile in clinical trials. However, it is important to note that no treatment is without potential risks or side effects. It is essential to consult with a healthcare professional to determine the most suitable treatment option for your individual needs and circumstances. Frequently asked questions about Apremilast. How long does it take for Apremilast to work? Apremilast may take several weeks or even months to show its full effects. It is important to be patient and consistent with your treatment, following your healthcare provider's instructions. Can I take Apremilast while pregnant or breastfeeding? Apremilast is not recommended for use during pregnancy or while breastfeeding. It is important to discuss your options with a healthcare professional if you are planning to become pregnant or are currently breastfeeding. Are there any dietary restrictions while taking Apremilast? There are no specific dietary restrictions associated with taking Apremilast. However, it is important to maintain a healthy lifestyle and follow any additional recommendations from your healthcare provider. Can Apremilast be used in combination with other treatments? Apremilast can be used in combination with other treatments, such as topical medications or phototherapy. It is important to discuss potential interactions or concerns with your healthcare provider. What should I do if I miss a dose of Apremilast? If you miss a dose of Apremilast, take it as soon as you remember. However, if it is close to the time of your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. Conclusion. Embracing the power of Apremilast for chronic inflammation and psoriasis. In conclusion, Apremilast represents a breakthrough in the treatment of chronic inflammation and psoriasis. Its unique mechanism of action, combined with its oral administration and favorable safety profile, makes it an attractive option for individuals seeking long-lasting relief and improved quality of life. While Apremilast may not be suitable for everyone, it offers a promising alternative to traditional treatments that often fall short in addressing the underlying causes of chronic inflammation and psoriasis. By unlocking the power of Apremilast, individuals can regain control of their health and well-being, embracing a new era of relief and hope. If you are struggling with chronic inflammation or psoriasis, it is important to consult with a healthcare professional to determine the most suitable treatment option for your individual needs. Together, you can explore the power of Apremilast and discover the potential it holds for transforming your life. Thanks for watching.